to show you what TouchLink is doing in the community.
I work to support the victims and survivors of domestic violence. I work because I remember over 26 years ago, I was on that street of Newark with nowhere to go, with no one to call. I work to support victims and survivors of domestic violence. I work to save life. I work because I want to be the light in the darkness, the hope for the hopeless. Yes, I want to be that dream. I work because I want to put an end to domestic violence. For the last 6 years, TouchLink has been supporting, empowering, and uplifting victims of domestic violence. So I'm calling everyone to join us at TouchLink, to be the hope for the hopeless, to be the light in the darkness, to be the answer to that woman that is crying, to be the shoulder to wipe away their tears, to counsel. That's what TouchLink has been doing. Triaging the cases, counseling the victims and survivors and their children of domestic violence, giving them hope, helping them. This time around, I'm saying let's do it together. Together we can be the hope in the darkness. Together we can be the light around us. Together we can be that village of support. So I'm calling you, let's come together and help and put an end to this pandemic. Yes, domestic violence is a pandemic. Let's end it. Let's put that family together. Let's put that mother and child together. Let's help them. This is why we are working. We are working to put an end to this darkness. My name is Yewande Efodili. I'm the president and founder of TouchLink, a non-profit organization that supports, empower, and uplifts the victims and survivors of domestic violence. Thank you.
Welcome, welcome. Good evening, everyone. So before we begin, let me introduce myself. My name is Brenda Adogun. By profession, I'm a psychiatric nurse practitioner. So this topic is very, very near and dear to me. I'm excited tonight because mental health is so important for all of us. This rally is about rallying to inspire, support, and empower. So throughout this entire session so far, we've embodied all of these things. The topic is rise. So in understanding mental health, we're empowering ourselves, we're supporting ourselves, we're inspiring people to go out and seek treatment. So I just want to introduce our speaker tonight. We have an awesome presenter today who works very close in mental health. I'm just going to read you her bio and I'm going to introduce you to her. We have Dr. Felicia Etuke tonight, who is going to be speaking to us. She's a licensed professional counselor with Grace Abounds Counseling, psychological consulting. With over 30 years of combined experience, Grace Abounds Counseling and Psychological Consulting specializes in individual counseling, couples therapy, child psychotherapy, adolescent psychotherapy, and family therapy. Among her areas of expertise are anxiety, depression, sexual abuse, attachment issues, domestic violence, women issues, marriage and relationship issues, substance abuse, so on and so forth. As a solution-focused therapist, her primary goal is to help you uncover your true potential and lead a life that is worth celebrating. While she cannot change difficult situations of the past, she can work with you to better understand and resolve challenges for your life. So I would like all of us to join tonight in welcoming our speaker, Dr. Felicia Etuke. If you haven't, please share the link on all your social media platforms so we can get a lot of people in here to hear what she has to say, because we are honestly going to be blessed tonight with what she is saying. So please share.
Well, thank you, everybody, for inviting me to this humbling experience. Yewande, I am so glad that, by God's grace, Sister Chinelo, connected us divinely. When I was listening to the video, it's just kind of, I was very emotional. It's like, this is real. No matter how many years, how long you've worked with victims and survivors, it's so real, so real. So I am so honored and privileged to be standing before you guys to do this presentation. So, I just want to delve into, the topic. I have a lot to cover, and some information that I'm going to be giving, we already have, but I think that it's good to have kind of a backdrop or even background definitions of certain terms or terminologies before we move on to the topic that I'm going to be presenting, domestic violence and its correlation with mental health and how it affects relationships going forward. As even if you're a victim or even a survivor, and definitely there is a difference between those two terms, a victim and a survivor, and I'll get to that. So what is domestic violence? Some of us, we know that it's kind of a pattern of abusive behavior in any form of relationship that kind of exists in either in home, one partner exerts pressure or aggression or even violence against or towards the other partner, maybe the vulnerable one. It could be a he or a she, but it doesn't really matter. And the goal is basically to maintain power and control. It comes down to one specific goal: power and control. How can I control this individual? How can I, remove the power that this individual has as an individual, created individual, and then, and manipulate, coerce, and then, and abuse the individual. It often happens in an intimate relationship. And so, some people have different views about abuse. Culturally, some of us are from an African culture. Back home, we feel that that used to be the notion that abuse is normal. Is the norm in a relationship, but it's not, as we're beginning to understand, even for some people that are coming in or migrating from different parts of the world. The good thing about domestic violence, there's nothing good about domestic violence, please, but I would say the good thing about domestic violence is it has no boundaries. It cuts across every socio-economic background, whether you're rich, from whatever background, it exists everywhere. So knowing what domestic violence is, what can we do to curb it? Or even like Yewande said, to stop it. There are so many things that we can do. But I also want to touch upon the types that are very prevalent within our communities, within our society, within even our families. Physical violence, what is it? It involves, the pushing, the shoving, the slapping, which people might say, you only slapped me, and there's no, I don't have any hurt. But a scar, it does not happen. It doesn't have to be. In New Jersey, the definition of violence, domestic violence, even physical violence, is when you touch the other individual without the person's permission. Let's keep that in mind. So if, for example, God forbid it, my husband pushes me or even touches me without my permission, and I call and I say, oh, I'm being abused, and the police come in, when they come in, they ask, did you touch him or her? and then the other person says yay or nay. Or if it's a yes, then the other person say, as the police will say, did you obtain her permission before touching her? If the response is no, then that constitutes domestic violence. That's the New Jersey law. I just wanted to put it out there that it doesn't have to be hurt or even having a mark on you for it to be constituted as domestic violence. In the domestic violence world, we always say that abuse is an abuse is an abuse. So any form of abuse is called abuse. I'm going to move on. So obviously we also have the psychological, which is also emotional. And we will see, when this is done through manipulation, coercion, you name it, even control, threats of harm, character assassination, isolating. There are different types, very, very many. And the patterns of abuse are there as well. Again, because of time, we really don't have that much time, because I like to have my presentations. I always like my presentation to be to give them to questions and answers, and so that people will have an opportunity to ask their questions for further clarification. So I'm just going to jump. The goal again is that power and control, manipulation. And I want to give us some stats. At the beginning, when we started this rally, I had given some stats about DV when there is a weapon in the home. But of course, again, some of us know that almost, or if not over, 20 people per minute. This is in the US, not in other countries, on average, abused by their partner. This equates to about 10 million women and men that are abused. This means, I'll bring it down a little bit, 1 in every 4 women and 1 in every 9 men will experience domestic violence. And the presence of a weapon, I repeat this, the presence of a weapon, whether it's a gun specifically in this time, in any domestic violence situation, increases the risk of homicide by 500%. 500%. So on a typical day, over 20,000 people or calls are placed to DV hotlines, including TouchLink, over in a given day, please. All right. So 1 again in every 5 women, 1 in 7 men in the US have been sexually molested, raped, full penetration. This is not just, touching, full penetration, rape. Let's call it for what it is. In their lifetime, this comes to 45.4% of female rape victims are walking around, and 29% of male victims rape. And 1 in 15 children, are exposed to domestic violence each year. And out of this number, 90% of them have witnessed domestic violence. I'm just going to move on, and so how does domestic violence then affect our mental health? I'm just also going to give us a few things here. Over the past years, and I will say over the past years, maybe a few decades, thanks to celebrities, there has been an increased public awareness and consciousness about mental health, wellness. So many people now think about their health. Often when they think about their health, they only think about physical health. And many are drawn to pay attention basically to physical health. And because physical health, or if you have the physical symptoms, many of you are in the medical field, we know that some of the symptoms are kind of manifested physically, so we take medication, we go see the doctor, or we do something to alleviate the pain and the hurt. However, when someone experiences something that is traumatic, and I want us to keep that word in mind, trauma, because that's what the victims go through. And even the children, even though some of them might not be physically or directly affected by domestic, but the fact that they were witnesses to domestic violence, they also experience traumatic events as well, or traumatic symptoms, vicarious trauma or secondary trauma, because it affects everyone in the family. So domestic violence, it's actually, it goes beyond the physical. It embodies every aspect of the victim, both mentally, emotionally, psychosocially, and physically, you name it. And sometimes their religion as well, spiritually. So what is mental health? Again, I'm going around in circle, it may look like, because we want to get to a place. So we do realize that everyone has mental health or emotional health. And God's intention is that we should be in good health, the Bible says, and that even as our soul prospers. So there is good intention for us to work in health, including mental health as well, because the Bible specifically mentions the soul prospering as well. So what is then mental health? It is our emotional, our psychological, and social well-being. Again, like I said, it's everything that the human being represents. It affects every aspect of our lives, how we think, which is our cognitions, how we feel, which will be our emotions, and how we act, which will be our behaviors. So all those three are kind of linked. So mental health is important at every stage of one's life, from childhood to late adulthood, even until death. And our ability to maintain our mental health can also be altered by experiencing chronic stress, anxiety, depression, shame, you name it, PTSD, and all of that come from domestic violence. Of course, we know that is a result of domestic violence. What is the correlation here? On average, more than half of female victims, or female clients rather, women that seek mental health treatment or that seek help in a mental health setting, have been abused by an intimate partner. More than half. Traumatic events such as domestic violence or intimate partner violence produces profound and long-lasting changes in a victim's psychological, emotional, and even cognitive abilities. So let's note, please, that even though one's mental health or even can be affected without the diagnosis of a PTSD or even anxiety or any of those diagnoses, but a woman's ability, a survivor's ability, a victim's ability to be productive at work, or even just be productive, provide and care for his or her family, engage in healthy relationships, or cope with adversity, it leads to mental health. I mean, these are impeded. The woman's ability, the man's ability, is impeded by the experiences of domestic violence. So the abuser feeds on the victim's mental health and uses that as a weapon to further coerce, manipulate, intimidate, and or abuse the individual. So mental health coercion becomes another form of tactic used by the abuser. Another tactic that the individual, and again, it goes, I'm talking about mental health here, which is tied very closely to emotional health, well-being. Another tactic that targets mental health include other forms of emotional abuse, which again, we have been talking about manipulation. I've been talking about coercion. I've been talking about, control, but also humiliation, public, the public denigrating, the public embarrassment, the criticizing, the name calling, the negating of anyone's views or ideas. That my ideas don't count, but only your ideas, or I don't have the ability to raise my children, or even yelling, even gaslighting. It's all form of emotional abuse, which again make up the mental health issues or whatever that we see in any clinical setting. And there are very many. So another impact that DV has is loss of identity. And basically that's one of the goals of the abuser, for the individual to lose his or own sense of identity, or a sense of loss of agency. And loss of agency, even identity here, is feelings of not being in charge of my own life, not knowing where to stand, not even what or what to say, not having the ability again to parent or even make decisions that I know are good for me. So those rights are removed from me. And all of these can cascade or have a cascading effect on the victim and the family at large, the children. So their inability to discern or being in tune with their own needs, which is really to be out of touch with realities, with those common things, contributes to their lack of identity, their self-protection, which again increases, or the high rates of re-victimization, or the rates of re-victimization is high because this individual is stuck because her identity has been marred, or his identity has been marred, and doesn't even have any identity at all. And of course, it leads to lack of not having ability to even engage in any meaningful relationships, whether the person is out of the relationship, is stuck, or when the individual moves on, the individual does not have the ability, because the individual's story has been, or narrative has been rewritten for the individual. Because again, that is the goal of the domestic violence. So the impact of domestic violence on the individual's mental health, physical health, there are too many to start listing. I'm just going to jump so many slides here and just go to the towards the end of my presentation. So what is our role as mental health providers, or even as victims advocates, such as TouchLink? Safety is always priority. When you work with victims of domestic violence, what we try to do is to secure their safety first. What does that mean? What is priority? What safety is always safety, no matter what happens, no matter how we dissect it, no matter how we design it, it is safety. And we design a safety plan for them, and with them, not really for them, because they do the work, but we just guide them. And one of the things is we connect them with a DV agency such as TouchLink and others as well, depending on where they are. And I'm glad that TouchLink is growing internationally, globally. I don't see it as just a US organization, from the work that you guys have been doing, and thank God for that. And also that we use some therapeutic measures or interventions to explore the emotional functioning of this client or of the clients. Insight is given into their belief system. Again, we need to go in and find out what their belief system is. Is their belief system such that they believe that it's okay that domestic violence happens in every marriage? That's how it should be. So we help them to kind of, again, change their cognitions and rewrite again what their perception about the domestic violence, about that phenomenon. And also we look for their support system, help them to identify their support system, and also what is their own strength. Because some of them, again, they've been beaten down so much that they do not even recognize that they are human beings. They don't even believe that they have anything to write home about, basically. And they believe what the abuser has written about them. So we help them to rewrite their story, or those narratives that have been written for them. So the goal of therapy always is to promote or improve their coping skills and work through the difficulties that they have and enhance their self-confidence. Of course, ultimately to strengthen their resilience. So ways to promote mental health wellness for survivors. Now, I interchangeably use victims and survivors. My background, I worked with the population for so long, over almost about 10 years, with a local domestic violence organization here in my county. And I realized that when they come in, or when they would come in, they will be so broken down. And that at that stage, I called them, they are rightfully called victims, because they are victims of the situation of their abusers or partners. But when they rise above the occasion and they start doing for themselves, they don't return, they get work, they start fending for their families, they find themselves in treatment, they are doing and putting, going against the grain and saying to themselves, you know what, I might have been here, now this is where I am. Then they are no longer victims, they are survivors, because they have redefined themselves and know that, no matter what happens, I'm victorious even in this battle. So
Dr. Felicia, we actually have a question.
Okay.
You mentioned a lot about the women who come into, and they are survivors at the end. How about the question actually asks, how can we help children exposed to domestic violence? Where does it start for them? Because they also are traumatized in what they are experiencing. So how can we help children exposed to DV?
So the question, your question wasn't too clear, but I think I understand what you said. Did you say the question was, how can we help children who are exposed to DV? That's a good question, because like I said, it's a family disease. Children are as equally, traumatized by the experience. Firstly, safety again, getting the family out of the situation, find them a safe place. Now, when you start working with the women, I personally was working with the women. However, we also had a program for the children as well, whereby therapy was also provided to the children. Depending on the age of the child, you could provide them age-appropriate therapy. If they are too young, it will be play therapy. But even though it's play therapy, whatever model that you use, the goal is for us to help them heal and give them the safe environment whereby they can always express themselves, express what they witness and how it affects them, and help them to grow. And the growth here is emotional growth. Children, again, are very resilient. They are not like adults. So the earlier you get them into treatment, the better, because once they get the appropriate help and the right help, it's very, very important to give them the right help, please. Make sure that they will grow from there, and of course the abuse will not define them.
We actually have another.
Yeah.
Yes, you did. There's another question. The question is, does it mean that one who has been exposed to DV or involved in the situation will have issues with all kinds of relationships, like with their families, friends, and colleagues?
Would you please repeat that question again? Your line is breaking.
I'm sorry. Does it mean that one who has been exposed to domestic violence or involved in the situation will have issues with all kinds of relationships?
Good question. Again, it depends on the survivor's ability, not the victim now. Survivor's ability to, again, I'm going repeatedly, I'm using the same word. It may look like it's very redundant, rising above the occasion, the amount of the help that the individual obtains afterwards, is the survivor able to, get enough help, process the help, and process the traumatic events, the hurt, and you name it, whatever that came along with domestic violence. It does not always, and this question is I would say it's very subjective, because it depends on the individual and how much the individual is able to do, how much work. But if the individual gets the help that he or she gets or wants or needs, because some of them will be very angry. There are also different, affects that they portray, the hurt. They're angry with everybody, with the entire world, maybe with a family member or family members that push them into the marriage or into their relationship. But if they're able to work through those hurts, they shouldn't have. Again, I'm not saying that, again, it's very, very difficult, but they shouldn't, because you should allow yourself to be vulnerable enough in treatment to just work through whatever issues that you have had through the abusive relationship. Another thing that I want to say is this, that is statistically, it is recommended that if anyone is coming out of an abusive relationship, the person should not jump into a relationship, whether it looks very, very healthy, because you're bringing in baggage, emotional baggage from the past relationship into the new one. No matter how the new partner or spouse treats you very well, those memories are still there. Those hurts are still going to be there, because you've not been able to work through them. And until you have done so, you would not be a free individual. And usually the projection is between 12 and 24 months before you get into a relationship. Don't forget that even though that relationship was an abusive relationship, it will still be considered a loss. And you have to work through. And there are stages of grief or loss of mourning. So you have to go through those stages in order for you to say, you know what, I am in the last stage of acceptance. And that's healthy.
I have a question. Do you find that, in your practice, despite you mentioned public awareness as being, more celebrities, a lot of people are more aware of their mental health. Are you still finding that people are unable to identify that they are a part and were involved or are involved in abusive relationships? Because I believe a lot of people might feel like abuse is only maybe physical, but are you finding that you're telling people that you're also being abused in other ways?
It's so, it's still a hush-hush word to use, especially amongst the elites. People are still in denial, and people feel stuck. If I leave the relationship, what will my family, how about my children? Where do I go? How do I start? So there are so many reasons that make people to be left to still find themselves in their relationships, or to be left behind in that relationship. So yay and no as well, because most of them that I see, when I say, do you realize that you are in an abusive relationship? They will say, yeah, I know that. But they don't take steps to do for themselves. Whatever the do means, again, it is very relative. It's up to them. It's good that they are working for themselves. It's good that they are taking care of themselves and, planning ahead and looking for ways to ameliorate themselves. But if the toxicity is still within the home environment, guess what? Everyone will still be affected, and the abuse will still continue.
I just want to encourage people to ask their questions. This is the time. If you have any questions, please, let's utilize Dr. Felicia. Let's utilize her knowledge. Let's ask the questions because no knowledge is lost. We can use this information to help others. We can use this information to help ourselves if we are in need. Please, I encourage everyone to ask some questions tonight.
And while we're waiting for questions, oh, somebody has her hand up. Rumi.
Yes, good evening, everyone. Okay, so there's someone really close to me that I would like to ask this question on behalf of. I mean, I know she had complained about, sometimes apparently she's in an abusive marriage. She's been married for like 5 years now, and those 5 years have been hell. Anyway, she noticed that recently that when she's driving, she just has a way of zoning off, right? And everything just blanks out. And then she comes back to herself. She's been having really bad headaches. She's not making good decisions. For example, she was promoted and she said, oh, she didn't want it, that she didn't want any extra stress because she was like, you know what, I beg. I don't want any extra stress. And I'm like, I'm beginning to question her mental health. So listening to you and all the things you were saying, I'm like, okay, I don't even think she's in a good space mentally right now to even make any form of decisions. We've been trying to, appeal to her, to leave, even though the man has said he's no longer interested and she should leave, but she's not making that move. We have begged, we have cried, we have, said everything we can, but she says she's not leaving. So how do I help? She's so close. She's actually my twin. So I'm here in the US. I don't, sometimes when I start thinking about it, I just start crying and I don't know how to help her. I have reached out to my dad, to talk to her, as in let her know that he's there for her, just to hear somebody say, okay, I'm here for you. Come out. I'm here. My dad is not taking that step. He's a pastor. So I'm sure for him, it's like, oh, what will the church say? And I'm like, look beyond your pastoral office. You are a father. So this African thing, it is, oh my God, it is, I'm sorry, I'm really upset, but it's really getting to me because I'm like, at what point do you drop your pastoral office and step in as a father to say, you know what, come home? If this man can look at you to your face and tell you that I don't want your daughter, at what point do you tell her, come home? So I'm sorry. So that's the headspace. It's horrible, but I don't know how to help her.
Yeah.
I don't know how to help her.
Can I say something before?
Yes, ma'am.
Dr. Etuke coming. Rumi, thank you so much for being transparent and for sharing that about your twin sister. First of all, I think it's the stigma, especially in Africa, we have that. Even generally, human being, really, there's always a stigma out there. And most importantly, if you are a leader, in a setting, especially as a pastor, there's that stigma out there. Even though it's not that you don't love your daughter, but it's like, what would the church say? It's always about other people. I really believe daddy need education, and God will give you wisdom to do it in love, to provide more education to your father, because not all pastors understand domestic violence. Not all pastors actually know what to do other than pray and fast and expect God to change things, by default. But education is very important. That's why we're doing what we're doing tonight. But I will say, just try to make sure you provide pastor with a lot of education. Especially, I have several pastors in Nigeria now that are well versed in domestic violence, and they are very open. They are outspoken about it. So if you connect with me, I can provide you some of that information. Maybe if you can send those videos to daddy, he would be able to at least have a little bit of sympathy, or be able to change his mind and provide better support for your sister. Okay, doctor, it's okay. You can respond to that.
Oh, thank you so much, Yonde. Thank you for that information. And my sister, what I want to say, Rumi, is you cannot, no matter how you say come out, most people have difficulties coming out, and there are many obstacles, but the only thing that we can do is to support. What you can do right now is to support your sister. You cannot, that said, it takes actually on average more than 5 times for a victim to finally leave her abuser. So you find out that they go and they come out and go back. They come out, or they make their mental decision and they to leave, and they still stay. And then they, it will look like you find the relationship or even the abuser, going back to the honeymoon stage. And then you think that everything is all hunky-dory. And then you find when they strike again, it's even worse than before, and they will leave. And sometimes when they go back after the 5th time, even after the 3rd time, you don't see the body of the victim. The victim dies because the abuse is re-intensified, and they can do anything to the victim. So right now, I agree with Yaounde, Sister Yaounde or Pastor Yaounde. Please be the support that they need. Create an emotional, and you know what, if you guys, I'm just going to read a little bit of what I have here as to show how much of a support system that we can be. We create an emotional safety plan for her. And what that means is, identifying a support system for her. It could be the list that Pastor Yaounde is going to be giving you, and you as well. They identify trusted friends and family members that can validate her feelings, validate what she's going through, and her struggles as well. Identify and work towards achievable goals, and the achievable goals could just be, little nuggets of goals. It could just be, today I'm going to call touch link, let's say, for example, or call a local resource. There are so many domestic violence, or a few, not so many. Some, I don't know where your sister is. If she is in Lagos, I do have some information that I can pass on. I had worked with a shelter, the first domestic violence agency in Lagos, actually in Nigeria, that had a shelter, and they still have a shelter right now. I'll be more than happy to, or in Benin City, she can actually call them. And then I did my first dissertation with this agency in Lagos, but they are everywhere now. And awareness of domestic violence is rising in Nigeria. That I can assure you. Help her to create a safe place. What is safety for her? What is that physical safe place for her? Rather than making her to feel that she is also. We're kind of reiterating what the husband is saying to her. Don't forget that the goal is to beat them down emotionally so that they know, and they tell them, when I'm done with you, nobody will pick you up. Okay, that's what they say. And they believe that the lies. And again, even though they might seem so easy and so simple, it is not that easy. Yes, I see what, that's right. Even the Lagos State government, they are well invested now in domestic violence issues. So when the self-esteem, the emotional abuse is the toughest one to heal from. The physical one, you will see the marks you will apply all these topical ointments and everything else, and it will heal. But the emotional abuse is the deepest and the most difficult to heal, and it takes several years to heal from that. All right, so help them to remind themselves. Help them to remind themselves of their inherent, or remind her of her inherent values, what she has done for herself, self-affirmations. Maybe she does not even have the strength to even do that right now. You might even help her with that. So again, she should practice. In as much as we want you to be a little bit compassionate towards her, actually a lot of compassionate towards her, but also we want her to practice self-compassion, because the last thing that they want is anyone to talk down or even call them names and say, you are stupid, what are you doing? You are intelligent, you're this and that. Help them to, again, to build themselves up, all right? Because they deserve it. And right now they don't even, she might not even know, she doesn't even have a life, and she wonders, why am I here? There's also a high correlation between domestic violence and suicidality. So we need to be very, very cautious the way we rub it in. You know, what are you doing there? Because we don't know what she's going through right now. Mentally, she's going through a lot. Her emotional turmoil could take her to the extreme of committing suicide. And there is a high rate of suicide, complete suicide attempts, all right, with victims of domestic violence. All right.
Thank you.
My
I do
pleasure.
encourage anybody who needs help or has questions that they may feel afraid to ask in the chat to definitely reach out to TouchLink. They have resources to better help whomever needs help. So I encourage you to reach out to TouchLink. Somebody has their hand up. Tina, I see you have a question.
Felicia too. I think Felicia also have a hand.
Okay.
Can you hear me?
Yes, we can hear you.
Yeah, my question, what are the roles of culture in domestic violence and mental health? The role of culture in domestic violence and mental health.
A good question. You remember the earlier when we started again, there's so much we can talk. We can sit here and discuss domestic violence between now and and Jesus comes. There's so much to talk about it. Earlier on, I did say that the culture actually, tells us that it's okay. For some of us that are coming from different backgrounds, Africa, for example, it's the norm there, or used to be the norm, and it's still the norm, even though some organizations are taking proactive steps, and even government to curb it. Is it going to be eradicated? I don't know. But the culture, even the culture here, the media, it's actually portrays domestic violence as something to kind of it's the norm. It's something that people should be doing. Coming from back home, I had horrible stories. When I was working with the population, I still work with them. I can't leave, because if I leave, what would people say? What would my family say? It's disgrace to my family. So the family image is being portrayed here. It becomes, the woman becomes it's like the trophy, the vessel that is being, what's her name, idolized in a very negative way. So the culture plays a huge role, Sister Tina, in the issue of domestic violence. And we, just like TouchLink is a strong advocate. I'm glad that she also has her roots back in Nigeria, working with different organizations and pastors, even in the church. Domestic violence is so rooted, and the woman cannot leave because, God is against divorce. When someone said that to me many years ago, I said, really? Even though God hates divorce, but God created you so uniquely like him, and will not even want you to go through abuse, because that is an abomination in his sight. It goes against his beliefs or our belief system. So how come? So it would take an effort. Again, we should not blame the culture. We should not blame anyone, the victim, or even the family, or even the media, for the perpetration of abuse. It's unacceptable. We call it for what it is. And if the woman is still undecided and doesn't want to leave, let's be patient and just prayerfully guide and help, and not condemn, because it takes a while for them to realize that, what, I wasn't meant for this life. I'm worth more.
Thank you.
Thank you. Can I say something, Dr.? It's okay. Can we talk a little bit more about family being transparent with the children?
Oh, wow.
because I've experienced a lot of kids. A lot of times, some of my clients, they complain about the misbehavior, excuse me, negative reaction of the children, which is as a result of DV in the house. They are just, covering it, playing the kids, and the kids know better, right? And of course, the kids is doing poorly at school, or the kid is still bedwetting, or the kid is stuttering. Those are the signs I was saying. So I just want us to talk a little bit about that. And it's because it's very, very dear to my heart, because if you don't correct it at home, these kids now grow up to become an abuser, or they grow up to become victims and tolerate abuse.
Thank you. I kind of, because of the time, I did not bring the children in here. Like I said, it's a family disease. And thank you so much for bringing that up. It's a family disease, meaning that it affects the children as well. And, children usually are considered the identified patients in a therapeutic environment, meaning that the children, the family will bring children and say, help me fix the child. But forgetting that the child is actually a mirror of what is going on at home, meaning that the child is also experiencing, sees, perceives, and knows what is going on at home, but we, the adults, act as if they're ignorant. They say that literature says that, and some studies that they have done, that even the fetus, the baby in the ovum that is baking in the womb, experiences the impact of domestic violence. So when it comes to transparency in the family, I am a strong advocate. If anyone knows me and knows me very, very well, I say to myself, I'm not going to die with truth. I will not be buried with the truth that God has given me. What does that mean? If I'm hurting, I will be vocal about it. There's nothing, I don't believe in covering up for my spouse's misbehavior. I call it for what it is, and I encourage people to do the same. Educate the children. The children already know, because the child is quiet, or even it's rowdy, or it's whatever it is, whichever behavior that they exhibit in their home, does not mean that they are not aware. Maybe that is their coping skills, because that is the only way they can cope. So the quiet one, that one is the one that you guys should look out for. That one, the one that you think that is very, very quiet and just minds his own business, is the one that, will, God forbid, it leaves the house and you will ask, what happened to this child? So the child also, transparency is key. Let the family, let them know, because like Yamunde said, the children, if it's the male child, they grow up, if these are not addressed either in therapy, get help for them. If these are not addressed, and even letting the child know that this behavior is unacceptable, the male child grows up acting the same way as the abuser. And then the female child, or whichever child, it could be a male as well, will think if mom does not do anything or does not act, will think that is the norm, and grow up, and also the cycle of abuse repeats. And then, guess what? The child will pick the same man that behaves exactly like that, and then the child says nothing because that was how mom acted. So they have this stress, they have anxiety. Anxiety is the reason why they wet the bed. Let them, teach them to be their own voices, to find a voice. And even if they can't say anything, the worst thing that you want to do is to have DCPMP in your life, because they will go to schools, and all those behaviors are being sought out by psychologists and also school counselors, or even the teachers. And if there is even if the likelihood of those things manifesting and they ask the child opens up, then you have an open case with the state. But most importantly, I think that getting help for the children is imperative as getting help for the victim as well, and even for the perpetrator if he or she wants to help.
Thank you. Somebody wrote in the chat, our actions or lack of it to domestic violence defines the lives and the futures of our children, which is so true.
Very true.
Do we have time for any other questions? Any questions? Well, I just wanted to thank you so much for tonight. Honestly, I have notes. This was great. This is so informative. I hope everybody receives something today. Again, please, if there's any questions that you may not feel comfortable asking, reach out to TouchLink. Tomorrow, Saturday, is the closing rally. It's the walk. It's where we will all meet up in Woodbridge City Hall on 1 Main Street in Woodbridge Township, New Jersey. So I encourage everyone to please get up. It starts at 10 a.m. and it ends at 12 in the afternoon. So I encourage everyone to get up and join us at, again, I would say the address 1 Main Street in Woodbridge Township, New Jersey at Woodbridge City Hall. Also, TouchLink does not do these things for free. A lot of the things that we do to help people does require money. And I do encourage people to support TouchLink in their reaching their goal so that we can, TouchLink has gone as far as going to Africa to help people in domestic violence situations. And we want to be able to support these women and families. So I encourage people to donate. There's a link, a secure link for you to donate. There's a QR code. You can donate through PayPal. Please donate through via PayPal or a link. You can go to touchlink.org where you will reach, where you can also donate through there. But please, again, join us for the rally. Come and walk, come support, as well as donating. And if you have any other questions, please reach out to TouchLink at info@touchlink.org. Thank you, Dr. Felicia. I appreciate everything tonight.
I
don't know. Thank you so much. Thank you so much, Dr. Felicia. That was a powerful session. I'm sure we've all been blessed. And I can tell you, we will not be silent. At least some of the information that you have provided, we will all take it out there and help somebody. You know, I've had several people that join our sessions, and now they've become advocates out there because through TouchLink, they've been able to receive a lot of information. So that's what I say, you know, don't leave this job to me alone or to one person alone. Go out there, you can help your neighbor, those resources might be useful, for your areas of influence, so please, let's go out there and just help somebody to live a dignified life. Thank you so much, Dr. Felicia. It's really a pleasure having you. I really appreciate it. Thank you, everybody, for joining tonight. Let's come to the rally tomorrow. Don't let anything stop you. Let's rise, let's rise. Let's rally, let's inspire, support, and empower. It's going to be awesome tomorrow. The mayor of Woodbridge will be there, and we also have other community leaders, coming to support us. So see you tomorrow by 10 a.m. prompt. No African time, 10 a.m. prompt. Help me, I want to see everybody, 10 a.m. prompt. See, I've been drinking my tea so that tomorrow I can talk, I can have more body. God bless you. Thank you so much, Brenda, for a good job. You did a very good job facilitating this. God bless you. Thank you, everyone. Good night. Bye-bye.
Thank you so much.
Thank you. Good
Thank
night.
you. Good night.
Good night. Thanks.
Good night, everyone. God bless.
Good night.